the 10th of March. If you didn't know, it's World Kidney Day today. And with this year's theme being Kidney Health for All, according to worldkidneyday.org, actually 1 out of 10 adults worldwide have chronic kidney disease, with kidney disease projected to be the 5th leading cause of death by 2040. But where do our Pacific people sit when it comes to kidney health? To have a bit of a talanoa about this and to help raise awareness about this is renal specialist Dr. Amelia Tekiteki. With that, I say malolele and welcome to the show this morning.
Hi, Aggie. Thank you for having me on the show this morning.
Oh, absolutely. Doctor, of course, we want to maybe just get straight into it in regards to, figures. In terms of our Pasifika people, where are our rates of kidney disease at the moment?
So the rates or incidence of kidney disease in our Pacific people is persistently higher compared to non-Pacific and non-Māori, and this trend has been ongoing since we first started collecting data on dialysis people ethnicity for those with renal failure, and this was back in the mid-1980s. So since then, our Pacific people have unfortunately just been leading in terms of kidney disease. In New Zealand and almost all parts of the world, the leading cause of kidney disease is diabetes. And then this is followed by glomerulonephritis, which is it's like an inflammatory type process that occurs in the small blood vessels of the kidneys. And there's marked variation in the rates by ethnicity. And the most recent data shows that diabetes accounts for 67% of renal disease in our Pacific people, compared to only 27% or mid-20s for our non-Pacific, non-Māori. And unfortunately, our people have, when they do get renal failure, because you can get mild, moderate, severe, when we do get renal failure and do need dialysis, our people unfortunately have a 3 to 6-fold higher risk of needing dialysis compared to non-Pacific, non-Māori, and our people are also much younger when they need dialysis. So this occurs as early as the ages of 15 up to their mid-20s. And we have much more severe diabetes. That's the most important thing driving this. So our Pacific people have diabetes as young, 10 years earlier than non-Māori, non-Pacific, and we also have much higher mortality, so higher death rate. So when our people have renal failure and start dialysis, they have a 3 to 5-fold higher risk of death, of dying, compared to non-Māori, non-Pacific. And so yeah, the stats are terrible, and it's been going on for so long.
Yeah, like you said, obviously since collecting data back in the 80s,
yeah.
I think, we and you've probably been asked this question many times, but why are we constantly seeing the high rates? What are the specific contributing factors besides obviously diabetes is what you mentioned a lot, but any other contributing factors we need to be aware about?
Oh yeah, so kidney disease it's a very complex condition, and the reason we're seeing these high rates, it's due to a combination of multiple different factors, such as socioeconomic deprivation, poor health literacy, obesity, and these are things that is more common in our people, unfortunately. But there are also some genetic and so biological conditions that make us more vulnerable to these conditions. Unfortunately, we can't modify these. It's inherent to us, you're born with it, but the combination of all these factors predisposes us to the conditions that lead to kidney failure. So it predisposes us to getting diabetes, to getting glomerulonephritis. And because we end up with more severe disease, more severe diabetes, more severe glomerulonephritis, that subsequently leads to the much higher rates of requiring dialysis. And I think that one of the reasons that these disparities in incidence has been going on for so long is because there's no easy fix. Yeah, there's no magic tablet that you can just give, or magic wand to just take all these problems away. Yeah.
Yeah, and again, yeah, if we could all just take a pill for anything,
Yeah.
I suppose the world would be a better place. But
Yeah.
like you said, we're predisposed. Obviously, there's genetics that come into play. What then are the early detections or key to dealing with this with our Pasifika people?
So one of the things with kidney disease is that it's a silent disease. So you don't feel it, you don't have symptoms until you have very severe disease, until you have the end stage disease which needs dialysis. And by that point, it's too late because the damage has been done, and you need dialysis. But what you can do in the early stages is managing before you feel the symptoms. And I think that's one of the hardest things, is because when you feel fine, you're thinking, why do I have to take these medications? I feel fine. But the thing is that you want to keep feeling fine. And so for those, as I said, diabetes is the leading cause. When you do have diabetes, it's by managing your diabetes. And this is by taking your medications, your insulin. And it's hard, you know, it's a daily thing. Patients need to take tablets once, twice, 3 times a day, sometimes 4 times a day to manage their diabetes, manage their blood pressure. So like, I know it's much easier to say. I admit I struggle to remember to finish my course of antibiotics, but you know, like it's much, when you think about when I see patients on dialysis and see how hard it is and see the struggles they face and see how young they are and the high death rates, it really, that's what really pushes me to try and make people aware that, you know, it's during those early stages when you do feel fine that you need to take your medications, that you need to look after your kidneys in those early stages.
That is very good to know. If you're tuning in, we're catching up with renal specialist Dr. Amelia Tekiteki. Would like to pose this question. 2 rugby greats, or maybe 3 I can think of. You know, we've got the likes of Joel Derry, we even had Olsen Filipaina, and even our good rugby Tongan legend great, you know, John Olomo, having to deal with like kidney failure. Is there maybe a possible link that connects, you know, the whole sort of playing sports and gaining kidney disease? It just seems very, you know, coincidental that all these rugby greats have been or were diagnosed with kidney failure.
Yeah, so no, there's no connection between playing sport and kidney disease. From what I read in the media about these rugby players, is that it sounds like they had what's known as a glomerulonephritis or a nephrotic syndrome as the cause of their renal failure. And these conditions are not the most common cause of kidney failure. It's the second most common cause, but diabetes is the leading cause. But studies have shown that glomerulonephritis is more common amongst our Pacific people. So there is no link. It is more common in our Pacific people. And I think that the reason that, we're making these connections is because rugby is #1 sport in New Zealand. You know, it's in the media, and so that gets publicized. And it's very unfortunate, and my condolences do go out to the families of these rugby players. But I think that these cases do highlight that, you know, glomerulonephritis are the less common causes of kidney failure, do overshadow the more common driver, which is diabetic kidney disease, which is what's killing the large majority of our people.
No, I like that. Thank you for clearing that up, though, Doctor. Any changes, though, I suppose, even to the health sector that you work in, that you'd like to see, maybe in order to change the Pasifika rates of kidney disease to actually decrease?
Yeah. So, and again, this would come back to changing the rates of kidney disease for our Pacific people. Will come back to changing and managing the underlying cause of what's causing the kidney disease in the first place. And I think I sound like a broken record when I say it comes back to the leading killer, the leading driver, which is the diabetes. And so what I'll keep saying it until I retire, is that manage your diabetes, because it's the high sugars, the high blood pressure that's really causing the progressive damage to the kidneys over time. And when you don't manage the underlying disease, so when you don't manage the diabetes, the rate of progressing to kidney failure just is so rapid. And that's why our people end up with such severe disease at a much younger age. It just all comes back to the diabetes, unfortunately. But again, there are other conditions, as I mentioned, like the glomerulonephritis, which is the second leading cause and more common in our Pacific people. And there's we're predisposed to some of those conditions, which we can't do much about.
And you know what, I like the fact, because it is, isn't it, trying to get to the root of the issue, right, before having to deal with the obviously the after effects of kidney disease. As we wrap up though, Amelia, I'd like to know then just what would be your key message for our community of listeners who are tuning in this morning?
I think one of the key things I do want to say is that, kidney disease is a silent disease, and that's the most important thing for our people to be aware of, is that you will feel well, when you do have diabetes, and the diabetes is just slowly damaging your kidneys for years. You will feel well because it's silent until things get too late. And I've had a lot of patients I've met when I meet them in clinic and they've got end-stage kidney disease, and we're looking at starting to dialysis, and they say, oh, what can I do now? Like, what can I do to prevent this? And unfortunately, by that stage, it's too late. So it's really going back to the beginning. So managing the things that really drive the progression to kidney disease, and knowing that, you will feel well, but that's the thing about kidney disease. And the most important thing is to be aware of it, because it's really a lifetime thing over the course of your life.
Sorry, I do want to quickly ask, and I know I asked you for your final message. Then do you think have the whole, not just managing diabetes, but health and well-being, that whole exercise, eating well, do you promote that obviously also?
Absolutely, 100%, because it is through these lifestyle modifications, so through diet, through exercise, things that we all know is what will prevent you getting diabetes, and then preventing diabetes prevents kidney disease, and it's all connected, and that's what I mean. It's so complex, and lifestyle things is not easy, I know.
Oh no, but look, hey, Amelia, thank you so much for just giving a little bit of insight into this whole world, and of course we thank you for your work for at least helping our Pasifika people. So just thank you so much for joining us this morning.
Thank you, Aggie, and thank you for having me on the show.
No worries, Malo Bito.